Hi, thanks for speaking with me today. I hope you could
No problem.
introduce yourself and
Uh-huh.
provide an overview of your research.
Okay. Yeah, so my name is Schyler Odum. I am a fifth year graduate student. I actually just had a meeting with my boss about leaving my institution right now. And so I'm got a job lined up after. I'm an organic chemist. And so my background is I have a degree in biology and a degree in biochemistry from Utah State University. I guess I really love school, so I added in a minor there in Spanish. And I came out here to UTHSC to work with Dr. Richard Lee as a medicinal chemist. But before that, I worked as an organic chemist for Frontier Specialty Chemicals. That's actually who I'm returning to work for again. And that's in Logan, Utah.
Congratulations. You must be
Yeah, thank
excited
you.
about that.
I mean, the meeting was tough. He's got a lot of work for me to do before I leave, so but I love it.
Absolutely. Well, I appreciate you taking the time out today to speak with me and the audience and just to get it out of the way. And I think I can do some magical editing work, but could you
Uh,
talk about the background noise behind you?
okay. So as you can see, have my safety glasses on, right? I'm in my chemistry lab right now, and unfortunately, our lab spaces are integrated with the chemistry lab, and so you can probably hear our UPLC, and that's our turbofan, which is an awesome piece of equipment. Water's aquated, but our turbofan is loud, and so I guess I'm used to it, so I don't even really hear it anymore, but it's probably constant noise for you guys. So,
No worries. You're coming through loud and clear. And yeah, I think we could start there. I'm not
right.
too familiar with UPLC MS. So if you could talk
uh,
about why that's a good fit for your work and how it differs from HPLC, that would be
okay.
of interest.
Yeah, for sure. And so we've had it in our lab for, I think, 3 years. And as part of my graduate school training, one of my responsibilities was to be the wrangler for this UPLC. And so if anything went wrong, instead of going to like one of our senior chemists, the lab manager, they said, Skylar, can you come take a look? Can you problem solve this and let us do the more important things, I guess? And so part of my graduate school was like really learning hands-on how to work this UPLC. And so this UPLC is ultra high performance liquid chromatography. And so that's the main difference between our machine and like other HPLCs is it's ultra high performing. And so what that usually means is that instead of like maybe 1,000 PSI, ours is running up to like 11,000 PSI if our column is a little more used. And so we're running at much, much higher pressures, which allows for much, much better resolution. And then the thing that benefits me the most is the sample consumption is super, super, super low. We're talking like less than a milligram. And so in a common HPLC are putting in milligrams of sample just to analyze it. And this one, I always tell people, it's like you just breathe on it or think about your sample and the sample well. The machine's going to be able to detect that and give you really good resolution and aid your other chromatography steps.
Very good. Yeah, that makes a lot of sense to me. I appreciate you getting into that. And yeah, I was very excited to talk about that instrument itself. But could you back up for a minute and provide an overview of your general research?
Okay, yeah. Sorry, I forgot to mention that. And so I work in antibiotic drug discovery. And so commonly well, I guess backing up, there isn't much profit incentive for antibiotic drug discovery from the big pharma. And the reason for that is because all the antibiotics that we use currently, the bacteria are developing resistance to those currently used antibiotics. And so what happens is if big pharma were to develop a new antibiotic, that would immediately get shelved as an antibiotic last resort, which means it's never going to get prescribed. It's never going to get used because they need a new emergency antibiotic because right now vancomycin is what's used. But we're seeing vancomycin with resistance. And so big pharma doesn't want to touch that because why are they going to spend millions and millions of dollars to develop this antibiotic that's just never going to get prescribed and is never going to be really sold in pharmacies, right? And so it's kind of left up to these academic institutions to do all of this research, to develop these antibiotic drugs. And so what I generally am working on are gram-positive on a novel target compared to the other common antibiotics. So I target gram-positive infections and then specifically biofilms as well. I probably can't go too much more in depth about the, specifics of that. I mean, if your audience is interested, they can look up the lab of Richard Lee, and you can look up at our past publications.
Okay.
I don't want to risk talking about stuff I shouldn't, but yeah, the lab of Richard Lee, we work on urea decipeptides, which are a cool peppermint antibiotic.
Awesome. I appreciate you mentioning that. One thing we spend a lot of time speaking about on this podcast is sample preparation. So I was hoping you could provide an overview of what's typically required and how time intensive it is.
Yeah, so that's the one, criticism that I would have of the UPLC. I guess you could set it up differently, but ours is set up currently for reverse phase. And so we're running it in acetonitrile and water with a 0.1% DFA solutions. Where we get into issues is if we're running like a normal phase chromatography, or we have a bunch of like DCR, methanol, ethyl acetate, depending on your system, those aren't super miscible and super compatible with the UPLC. And so we've actually run into some issues where I think we had some samples crashing out in our lines. And like I said, we're doing like tiny, like less than a milligram samples. And so these pores are tiny in our lines, right? And so we end up getting samples crashing out. We get overpressure issues and pumps failing and stuff like that. And so the recommended solution is that we have to blow down every single sample that we have from our organic solvent, dry it out completely, and then resuspend it in like a methanol or an acetonitrile or water. And so that gets super annoying and super time consuming when you're running like a really big, like we use biotage chromatography columns. So if we're running a bunch of those samples and you have 15 samples of 15 peaks, and you have to go in, you have to dry each one of those in order to test it, it gets pretty annoying. And so kind of our workaround is, like you mentioned to me, is you got to use a nitrogen blower. You got to get these samples down so you're able to effectively analyze your equipment, but also extend the life of your equipment of the UPLC.
You mentioned going to dryness. What would you say is the average starting volume?
So like I said, you can really like just with a glass pipette, just kind of drop in with your finger and move that over to your sample well, right? And so if you're working in DCM, something that evaporates very quickly, like you can start with like less than 10 microliters, a couple microliters, dry that down. But then, you get your samples confused, your peaks confused, you have to go back, right, and stuff like that. So, we work with really small samples, and that is, like I said, the benefit of using a UPLC system.
Certainly, you've identified a lot of challenges you're facing in sample prep. Do you have any leading ideas on how you're going to be able to improve it over the coming years?
I don't know if I looked on your website, right? Like you guys have some really interesting and nice nitrogen blowers that would make our work pretty high throughput. I was mentioning to you on camera, our nitrogen blowers, like from the 60s, I wasn't even a thought in my parents' mind, right? And so this thing is horrible. Like it sometimes blows out nitrogen where you want it, sometimes doesn't. Sometimes it's too fast. Sometimes it's fast enough, really loud as well. And so we run into problems with that. And so I think, honestly, just upgrading our equipment is probably the best way forward for us. Because, we can't do our separations without using like our normal phase solvents. So we have to find a way to dry them out.
Yeah, fair enough. Outside of sample prep, what's the most challenging aspect of your research?
So for me personally, and like I've mentioned, these other papers that people can look at, the antibiotics that I'm making have a molecular weight of about 150 AMU. And so when you think of a drug or medicinal chemistry medicine, no one's ever thinking about something that giant. It's huge. And so something that's very difficult for me is NMR resolution, is taking these samples and actually proving that it is exactly what I said it is. I said it's a 18-step synthesis, and so I'm doing lots of solvents, lots of chromatography steps, and then at the final step, I got to get rid of all my solvents for my NMR, and so that's also a difficult thing. getting rid of all these extra solvents and things.
Makes sense. Are there any other points that you'd like to share with the audience?
For me, it's always support antibiotic drug discovery because there is like an actual need out there. And I think that's an overlooked thing. My current institution is more focused on cancer. And so people, I think, forget that these cancer patients or these other disease models and other diseases, the comorbidity is often due to infection and sepsis. And so I think people really need to take a look back at antibiotic drug discovery. I think we need to put a little more, probably governmental money back into antibiotic drug discovery, or else we're going to have a pretty big problem on our end for the next 20, 30 years.
For this type of research, are there any conferences that are typically of focus when it comes to presenting this type of work?
Yeah, so the one that I've presented at was the Gordon Research. Well, I went to the seminar that's like for more trainees, and there's a Gordon Research conference. And so an antibiotic drug discovery one, I think it's in New Hampshire every year. I mean, beautiful. And so I'm in Memphis, Tennessee, and it's super hot, super sticky. And then so my boss sent me up to New Hampshire in the fall, and it's beautiful. And so I love heading up there. And I think they do a really good job at paying for people to go. So it's not like a huge cost for other academic institutions, but they can just go up there, present their novel work. And then there's a few more Gordon Research ones. I think there's one in California this past. And then, I mean, I do gram positive. There's also gram negative work. And then there's tuberculosis work. And then there's NTM work. So there's antibiotics it's a bigger thing than I think people realize.
Well, New Hampshire is about 20-minute drive.
Yeah, I was going to say, close to you guys. Yeah, so. I'm jealous. Yeah.
Well, maybe not too jealous right now. This is about the coldest 2 or 3 weeks of the year.
I'm moving to Utah here in about a month. And so that's where I did my undergrad. So I know about snow and cold, but.
Very good. Well, Schyler, I really appreciate the time today, and I hope we can chat soon.
Thank you so much for this opportunity. I always love talking about my work.